Millions of people in our communities face a heartbreaking gap. They can't afford health insurance, but they also don't qualify for federal programs. This leaves many without access to essential health care. In today's episode, Roger and I sit down with Laura Lyerly, the executive director of the Community Free Clinic of Cabarrus County, to discuss how she's tackling this challenge head on. We explore how the free clinic supports clients who don't have access to health insurance, how they use data to understand client needs, how they track services provided, and how they build partnerships to magnify the impact of their work.
Stanley is a good story to tell in that he moved down to North Carolina and he moved from New Jersey where he had Medicaid. And at the time, we did not have Medicaid expansion. So while I applaud that we now have it in in North Carolina, it's not as robust as it needs to be. And that's one of the problems. But B, he came here and he couldn't get a job because he had uncontrolled blood pressure and diabetes, actually. But his diabetes was keeping him from getting a CDL. So he couldn't drive commercially. So he couldn't afford insurance, which is a major financial strain on so many families. So he was able to come to us here at the free clinic. We offer free health care for any Cabarrus County resident at 300% of federal poverty guidelines. So he was able to come in, get free medication. He was then able to get his CDL, and then he was able to afford his insurance and was able to leave us. So a great story of how we were a stopgap for someone who needed us just in that period of time. Then we have other patients that will always be with us because they will never get Medicaid. And we have lots of great success stories of how they started with us 20 years ago. One in particular, we found her breast cancer. We were able to navigate her through our local hospital system that participates in the Health Net Cabarrus program. So they recognize our community free clinic program and they offer charity care for her. So we were able to help her through the stages of referrals, the medical navigation of teaching her because the literacy level was somewhat low, and educate her about her cancer. She had surgery, she went through radiation, and then was able to come out on the other side. She is still with us as a patient over 20 years later. So
Wow.
We have one side of the continuum and then the other, but either way, we're happy to be here and serve our patients.
Well, Laura, thanks for sharing that. That's those two examples you provided are excellent perspectives of the wide range of services that an individual can receive through your organization, right? We know that cost is often the first barrier that individuals think about when it comes to healthcare, right? So beyond cost, if you can share with us, what are some of the less visible challenges that prevent people from seeking care?
Inequalities in healthcare access, systemic drivers beyond just those of traditional healthcare would be social and behavioral factors. It could just be something as easy as transportation to get here. It could be, just inability to get in with other providers here in the area. You don't think of Cabarrus County as being a place where it's hard to get care. Unfortunately, we are in an area that we don't have enough providers for the amount of people we have now living in the area. We have not been able to keep up with that growth. And then for that matter, obviously, it also goes back to financial reasons. We are Cabarrus County's only free clinic. So if they're looking for care and they can't afford it otherwise, Mecklenburg County has several clinics. We're it for Cabarrus County. Now, don't get me wrong, we're happy to serve. But again, we have plenty of capacity. But if we were at capacity, then that would be a struggle as well. So many different barriers. We made sure that we have increased our time that we're here and able to serve Pre-COVID, we were only 2.5 days per week. We're now 4 9-hour days. And we also offer a night clinic once a month to try and get, those people that work during the day, make sure that we can see them at night. We've also brought in some specialty clinics over weekends to be able to better serve patients, because we know we have both people without income and that are working poor. So they are working 1, sometimes 2 jobs and still can't afford health insurance. That's an awful place to be in America.
Yeah, very much so. Aside from costs, it sounds like there's a lot of different layers involved with an individual not seeking care, whether it's transportation, like you had mentioned. Cabarrus County it's a rural county. It's not like Mecklenburg County, which, although there are certain spots of Mecklenburg that are rural, there are different methods of transportation, whereas Cabarrus County is a little bit more different. So transportation is a challenge. Probably also access to accurate information, right? That's another issue. And then the other one I could think of real quick is language. Language barriers prevent
Language barriers,
services.
distrust. Maybe someone's had a previous negative experience. So many times we have people coming to us that haven't been seen by a physician in years, or if they have, it's been at the emergency room when something was really bad. And the negative experience is there from waiting 5-6 hours just to be seen. Obviously, yes, language barrier, a huge one. Language barriers are something that we're really happy to be able to say our primary provider is bilingual. So she's from Colombia. So she's able to speak to 99% of our patient population in their native tongue. Unfortunately, that other percent, we typically have translators for, and sometimes have to use Google Translate, but language barrier is a huge one. Yes.
Of course. I know that as an executive director of an organization, there's so many things that you have to be, prepared for. And so, of course, there's just an abundance of things to think about. The one piece I did want to mention before Drew asks the next question is the appreciation of recognizing that in Cabarrus County, there has been an increase in the Spanish-speaking population and community. And so what the Community Free Clinic has done is y'all have built a bridge and able to provide some really crucial services in Spanish. Not only that, though, you had mentioned earlier that y'all are a freestanding, no-cost clinic, right? I think
Correct.
that's how you phrased it. Nobody who comes in to utilize services pays a dime. It is free for them. And there are other clinics around the community, whether it's in Mecklenburg or Cabarrus or the neighboring counties, where there is a cost connected to it. So it's not fully free, whereas y'all are a fully freestanding community clinic. That's excellent.
Thank you so much for tuning into today's episode. Now, before we dive back in, I wanted to quickly share a resource that I think you'll find incredibly valuable. Now, as a social sector leader, you know how important it is to have reliable data to demonstrate your impact and to win grants and funding opportunities. But finding and using the right information can often feel overwhelming, especially when you've got so many things going on and you're juggling so many responsibilities. Now, that's why I created the Data and Evaluation Made Simple Toolkit. This toolkit offers clear and practical steps to help you get the data you need for community assessments, program evaluation, and strategic planning. It will show you how to stand out with U.S. Census and Social Explorer data, how to design surveys and focus groups to really find out how your programs are making an impact, and give you the strategic guidance you need to help you design a data-driven strategic plan. And while anyone can benefit from it, it's tailored specifically to professionals in mental health and substance use prevention. Ready to simplify your data? Download your free toolkit today at www.commongooddata.com/simple. And again, that's www.commongooddata.com/simple. We talked about language barrier being an issue. And I know that that's an issue dear to Roger and my heart. The barriers that language can be and access to care and all types of varieties. I remember seeing some data recently that it was as many as a third of Latino households, and I'm not sure if it was Mecklenburg County or North Carolina as a whole, who didn't have access to insurance. And that's just kind of one example that it really opened my eyes with the more insurance kind of getting out there between the Affordable Care Act and expansion of Medicaid. I have this idea that more people are getting insurance, but it's really not always the case for people who are especially caught in those eligibility brackets where they just don't fit into an existing program or opportunity. So I'm wondering, how does the community free clinic think about or use data to kind of understand or talk about healthcare needs in the community? What's going on? What are you seeing in Cabarrus County? And are there specific metrics or trends that kind of guide your services or highlight gaps in access?
So we use data in a myriad of different ways. We want to make sure that we represent our community. So making sure that we are doing targeted outreach to make sure that we are increasing our patient services as our community, but also our patient population needs those. So, seeing a need in earlier labs, making sure that we are able to put in those earlier labs. So then in turn, our own metrics where we assess ourselves, our patient count, our number of appointments that we have, all of those, making sure that we're hitting improvements or seeing improvements with those year over year positive trends. All of those are good ways for us to make sure that we are doing our job to serve our community and best serve our patients. We've had a 120% increase in our patient population over the last 2 years. Like
Wow.
Roger said, we've seen the increase in the Latinx population. We've moved from 37% Latinx to now about 48% Latinx in the last 2
Wow.
years.
Mhm.
So we also use that to target our outreach to neighborhoods that we know are more Latinx. And we listen to our patients for that. Tell us, where do you go? What do you do? We work with El Puente, which is a Latinx advocacy and service organization here in Cabarrus County that Roger's involved with. Sandra is on our board, and just making sure that we are getting the word out where patients need us. There's no reason for us to go to the Cabarrus County Country Club because that's not where our patients are.
Yeah, nice shout out there to El Puente Hispano and Sandra Torres, who is a part of a great organization. But a lot of the collaborations that the Community Free Clinic has with community organizations and leaders who know the community is really crucial and important. Drew and I recently did a podcast with someone who talked about the importance of community bridge building and how to utilize leaders in the community to have access and trust with certain communities. So, yeah, I love that there's that initiative with El Puente Hispano and with Sandra Torres and how that's a bridge builder, because that way you can get access, you can give access to the community that's accurate about health and healthcare and access to healthcare. So, Laura, I'm going to ask you a little bit about how you evaluate your success at the clinic. So, what are certain ways that y'all know that you're doing the job that needs to be done, right? How are you taking that information and making the changes that need to be done in order to improve quality of care?
Great question. So obviously, as a medical center, we have an EMR, so electronic medical record. From that, we're able to pull our diabetic patients and check their A1Cs. Where are they in comparison with what is medically acceptable as medical norms? Unfortunately, free clinics tend to run higher. Obviously, we have all those other barriers that our patients are having to work through, the social determinants of health,
And
all the other barriers that we've already talked about. So typically we tend to run a little higher, but still considered normal. So we take those records and we compare those against other free clinics. So North Carolina has 71 free clinics in the North Carolina Association of Free and Charitable Clinics. So we're able to see where we stand with our H1Cs, with our blood pressure, what percentage of our patient population has controlled blood pressure. Same for smoking cessation. Where do we rank compared to other free clinics, and not even just here in North Carolina, but also nationally? We have a National Association of Free and Charitable Clinics. So from there, we're able to see that, hey, our smoking cessation is way down. We're only 20%, but national average is about 35%. So, that's a victory. Obviously, looking at appointments, how what's our no-show cancellation, what are our percentages of late cancellations, because we want to make sure that we're able to put people in those slots because they're not unlimited. We don't have, 10 doctors here at any time. We typically have one, sometimes 1.5. So one full-time provider and then a half-day specialty provider that will come in. So we want to make sure those are booked up so that we're able to see as many patients as we can. We've talked about our enrollment. So obviously growing our patient population is important. That's one of the ways that we determine, how are we a success in our own book. But then also working with the community for specialty clinics, how many people did we vaccinate this year? We have a partnership with Walgreens where they come in and they're able to give flu vaccines for our patients. Last year we did 68. This year we had over 110, I believe.
Also,
So a huge improvement. How are we able to work with other nonprofit organizations to make sure that we are not only providing healthcare here for our patients, but also addressing those other social determinants of health, because we know that plays such a huge part in their healthcare. So we work with CCM, which I'm pointing down the street because they're literally about 2 blocks from us. Through their help, we were able to become a Second Harvest Food Bank location, and we're able to help some of the social determinants, obviously food insecurity of our patients. So working with them, we work with so many of the nonprofits here in Cabarrus County. We're at a great place where nonprofits don't compete with each other. We actually work together well to make sure that we're best serving our community. So when we have someone that has, food insecurities, while we're able to address a portion of that, we're able to get them, connected with CCM for more truly what they do. And also for housing. We have lots of patients with housing concerns. So, getting them set up with WeBuild or CCM or Habitat for Humanity or all of those other groups here that fulfill that need that we do not.
Sounds like y'all understand the importance of collaboration and that it is a key factor in addressing some of these complex challenges like healthcare access, food access, or like economic mobility. And that y'all are partnering up with folks and sharing that type of data with them so y'all can address these needs from a more comprehensive approach. And then in fact, meeting the needs of the community. So that's not living in silos, but you're collectively working together. Yeah.
We know we can't do it all. And while we can help, their diabetes, if they don't have healthy food to eat long term, we can teach them about it. But if they can't afford it and it's not readily available, that's something they're just not going to see those same improvements. So truly trying to address the whole person.
One of the things I've noticed with organizations who are doing this collaborative work, or one challenge that they often have, is that they want to be able to work with each other. And maybe it's through a referral process where, they meet with somebody, they provide this service, but they know they need healthcare, so they refer them to you. Or maybe it's about accessing some resource that they might not have inside their own place, so they collaborate with somebody else. But one of the challenges that a lot of nonprofits run into in this is finding ways to really make those collaborations be kind of seamless. And sometimes the challenges come around, especially with data and privacy issues, referrals and HIPAA and all that kind of stuff that can sometimes be a barrier for those organizations. And I know you're smiling because you're sure you've experienced this in so many different ways. There's not always a perfect solution to these challenges, but what have you found success in as you've been trying to work through some of these partnerships that really help make the sort of continuum of care across all of healthcare services and related services that you provide work well for your patients?
Well, patience. You need lots of patience sometimes. Unfortunately, in the medical world, there's no such thing as we can do everything quick. That's just not the reality, especially when we have such a shortage of providers that are willing to do that free care. I want to give a shout out to CHA, Cabarrus Health Alliance, and Atrium. as they have been great long-term partners of the clinic as well as so many others, but they are a part of our safety net here with our Health Net Cabarrus program. Through that, we offer 18 different primary care homes, and most of those are through Atrium. Also, shout out to Novant, who will be joining our Health Net. That has never been a part of it. So we've had 24 great years of Atrium support through the Health Net. And now we're excited now that Novant has such a large presence and is growing their presence in Cabarrus County that they'll be coming in. But that process is a slow process, new to the area or new to us. And then, of course, every independent clinic does things differently. So just learning how we're able to work with a large hospital system and even existing programs. When Atrium starts a new program, how do we work with the diabetic clinic there? Because we're not a part of Atrium. So making sure that we have the MOUs in place to be able to share the data, be able to get the report, of course, cleaned up, so no HIPAA or other important information is shared that shouldn't otherwise. It just takes time sometimes. So it's worth it in the end to be able to best serve our patients.
I think, again, the importance of collaboration is one of the key components of the success of community work, or at least initiatives that serve the community, like the Community Free Clinic. So while the clinic provides critical support, systemic change is often needed to address healthcare access at its root. So what policy changes or broader initiatives would you like to see to better support your patients, your clients, and others in similar situations?
We would love to reduce poverty and improve economic abilities of our patients so that they wouldn't need our services. It'd be great for us to work our way out of our jobs. We know that's not going to happen anytime soon. So until then, whatever we can do to help those in poverty, insurance reform. We said, like I said earlier, I applaud that Medicaid expansion happened in Cabarrus County, not just in Cabarrus County, all of North Carolina, but here in Cabarrus County, it didn't affect nearly as many patients as we thought it would. We lost less than 10% of our patient population to Medicaid expansion. So we still saw significant patient growth despite that. So increasing Medicaid would be great because we have patients that are right at that 139% of federal poverty level that they didn't get expansion. They still need our services. Insurance reform. I don't need to tell anyone that needs to happen. That's such a major problem in the United States. Other systemic things would be improving health access, making sure that people have culturally appropriate care. Really important because sometimes without knowing the backstory of someone, I'll use Lucia, from Colombia, understand, someone that came in from Colombia and they're able to, share those shared life experiences. She understands. And there's also that level of trust that comes along with that. Let's see, advancing racial equity is important because unfortunately, that's still a problem here in almost 2025. And then last but not least, we still have patients that struggle with substance use disorders. And until those are dealt with and other behavioral health concerns, they're going to continue to have negative cycles and not be able to get to a better place. So,
Yeah, I think it's important for community leaders, nonprofit community leaders, to be at the forefront of policy change and advocacy and making sure that, sustainability and accountability is there from lawmakers, from, policymakers, right? And then the leaders, the nonprofit leaders becoming the policymakers as well. So there's this sharedness of improving the quality of life of all communities. So thanks for sharing that.
of course. Thank you.
Well, Drew, I think it's time for my pop culture time, right?
Go for it.
So I've been thinking about this a bit, and I'm going to go with we're in this season of holiday now as we end the year. And I'm going to go ahead and go with 80s and 90s movies, the holiday movies that you can takes you back. Like if you see it now, you immediately go back to that time. I have it's just hard because the one I'm getting ready to say is controversial because some people do not consider it a Christmas movie. There's debates on this.
Oh, I think I know which one you're talking about.
I heard it on a podcast and the hosts were going back and forth. Whew, I'm going to say Die Hard. It's got to be a movie that popped in even during this time. Like, oh, it's Die Hard, like Christmas. But there's debates on whether or not it is or isn't a Christmas movie or a holiday movie. I'm going to choose Die Hard. Die Hard's my movie. All right. Drew, what you got? Laura, you go last. Laura, we let our guests go last so they can think and marinate on it. So,
oh man. Well, so I would say the one that brings me back to 80s or 90s is definitely Home Alone. I feel like, and all those movies come back and bring me that era. Just the house, the decor, all of it is so. But I think for this podcast, I do want to mention It's a Wonderful Life just because it's such a sweet movie and I love it so much. But it also has a lot of themes around economic insecurity as well. And there's a little healthcare in there too. Mm-hmm. So I think it kind of links back to this episode in a great way and how these financial pressures that people can be put on can cause this real hardship, but also how a community can kind of come together and wrap around that. And I feel like that's a very similar theme to what you're doing at the Community Free Clinic.
I love that, Drew. Thank you. So, Roger, I am completely with you 100%. Die Hard is always my favorite Christmas movie. It is a fight I get into with my oldest son, Patrick. He is the Home Alone and actually Home Alone 2. And I am Die Hard that it is a Christmas movie.
Now, Drew, we've never had a guest pick one that's similar to one of the co-hosts. So I might have to battle Laura and say, you can't have Die Hard because you have to have your own. But I'll give grace.
But you both agree that it's a Christmas movie.
Oh yeah.
I would say it is.
Yeah, because this is a debate that comes up. So I'm excited. We got some listeners out there who disagree. Add something in the comments. Let us know on social. We'd love to hear if you think Die Hard is also a Christmas movie. Laura, thank you so much for joining us today and to kind of walk through some of the ways in which you're able to serve those who are just caught in that space where they don't have access to insurance for them. It's such an important area of work, and to help others get to understand how your clinic works and serves those in Cabarrus County. For those who want to learn more, how can they find out more about the Community Free Clinic?
Please find us online, communityfreeclinic.org. We're on Facebook at Community Free Clinic, Cabarrus County, and then also on Instagram and LinkedIn. So we would love to have any new supporters, volunteers, or patients. We are open for all. So thank you all for having me. I appreciate you.
Today's conversation with Laura highlighted 3 critical themes: the persistent barriers to healthcare access, the power of data to drive meaningful change, and the importance of building strong partnerships to serve those in need. If you'd like to hear more episodes like this, or to learn how your organization can increase its capacity to use data effectively, search the Common Good Data podcast on Spotify, Apple Podcasts, and YouTube, and visit our website at www.commongooddata.com/podcasts, where we have tons of resources to help social sector leaders like you magnify your impact. Thanks so much for listening.